capable of providing the necessary compliance and documents to make sure that we will be able to resolve all of their COA findings. So good morning po sa lahat, and I will now present the COA findings for this COVID response, and we will give our rejoinder in terms of the observation. Next slide, please. COA has flagged that the DOH was unable to utilize all allotments under Bayanihan 1, 2, and foreign loans of 11.8 billion at the end of December 2020. Mga kababayan, hindi po ito nasayang. Due to enactment of continuing appropriations of Bayanihan 2 funds, 4.2 billion or 83% of the 5.1 billion of the funds have been utilized as of June 2021. These funds were still used to pay for salaries of our HRH emergency hired. Some were used to pay for benefits of our health workers, such as the SRA, and death and sickness compensation, procurement of needed medicines, and medical supplies in line with the pandemic. As for the 4.7 billion under foreign assisted projects, or the FAPs, these funds have been requested for reissue of SARO in year 2021. Hindi rin po ito nasayang because those procurement and other COVID-related activities which were not accomplished last year due to varying factors were done in the first semester of the current year. This includes procurement of vaccines whose negotiation did not proceed in the later part of year 2020. Also procured this year were 70 units of patient transport vehicle, design fee for the 5 types of isolation facilities, and 2 BSL-2 laboratories, ancillaries for the Pfizer COVID vaccine, civil works for the 13 isolation facilities, and 2 BSL-2 laboratories, and 3PL for logistics needed ancillaries. Due to the timing difference of the audit reporting period and the submission of final financial accountability reports to the DBM, obligation of 1.09B was reported as additional utilization for calendar year 2020. However, 980 million, part of the unobligated balance, came from Bayanihan 1 from 2019 appropriations savings, which automatically lapsed at 2020 year-end. Next slide. On the deficiencies in procurement documents and procedures, this is partially resolved. 2.48 billion mention of deficiencies was already addressed by the procurement service of the central office. The said 2.48 billion worth of central office procurement contracts were awarded in accordance with RA 9184. The COA observation on lacking documents, specifically FDA-issued licenses, is noted, but the procured items are not FDA registrable. On the alleged deficiencies in posting of procurements, the contracts are all posted in the DOH website. We take note in the preferred arrangement of postings in the DOH website as recommended by COA. For the remaining 2.5 billion, the DOH operating units were given directives to immediately comply with the COA recommendations. Also, the DOH Internal Audit Service is currently conducting review of transactions pertaining to Bayanihan 1 and 2 funds. Next slide. COA flagged that 74 million worth of medical equipment and supplies for COVID-19 response of various hospitals remain unutilized at the end of the year 2020. These observations were mostly resolved. While waiting for completion of COVID-19 wards in some hospitals, some equipment were used by other wards in that same hospital. We believe that our hospitals should also be given leeway to adjust their operations kung saan po ang pangangailangan. Nonetheless, we have asked the concerned units to respond to this. COA also flagged that while the implementing units went through emergency procurement process, some deliveries were delayed, thereby negating the use of the method. However, these operating units acted fast, and we believe that the ensuing delay is just beyond their control. However, we continue to remind them that they should strictly enforce delivery dates for such vital supplies and equipment from their suppliers. Next slide, please. COA also observed that there were lapses in the handling of cash advances and petty cash fund by the different operating units. Concerned operating units reasoned out that due to immediate urgent needs of the hospital, time constraints, and unavailability of the supporting documents required them to liquidate. Additional cash advances were given even without liquidating the previous ones. Ang mga cash advances po na ito ay ginamit pambili ng mga emergency supplies and materials na kinakailangan ng mga COVID patients. Ang iba naman po dito ay na-delay lamang ang pagsumite ng kaukulang dokumento dahil sa mga work from home scheme na ating ipinatutupad sa mga opisina. Nevertheless, the Secretary of Health directed concerned operating units to immediately submit complete documentation in support of the liquidation of cash advances. COA flagged that our transfers to PSDBM for COVID-19 related funds were not covered by Memorandum of Agreement. Ito po yung mga funds transfer namin sa PSDBM upang ibili ng PPEs, testing kits, medical supplies, and other hospital equipment for COVID-19 response. This is partially resolved. As per consultation with PSDBM, PPEs listed in their website as commonly used supplies and equipment do not require a MOA with procuring entity citing the following legal basis. GPBB Resolution Number 03-2020 approving the adoption of efficient, effective, and expedient procurement procedures during the state of public health emergency. Section 53.5 of the updated 2016 revised IRR of RA number 9184, letter of instruction number 755 and EO number 358-19 on the establishment of an integrated procurement system for the national government. COA also flagged that we need to await liquidation of all pending procurements before we transfer again to these agencies. But we cannot afford to do that given the emergency. You see, full liquidation will be possible only upon full delivery of the procured items. But if these items are to be delivered in tranches, then we will have to wait. We need to continue procuring. We cannot stop and wait. Constant coordination with the procurement agencies to ensure that our needed supplies are delivered at the soonest possible time. To date, a total of 31 billion worth of commodities was reported by PSDBM as delivered. Next slide. COA noted that there were around 4.8 million claims for compensation benefit which have not been paid at the end of the year due to varying valid reasons, such as lack of required documents. However, this was immediately paid by the regional office upon completion of the lacking documentation. While the processing units committed to their turnaround times, all our facilities must work like clockwork to ensure timely and availability of funds. We have reiterated adherence to our processes across all implementing units. Next slide. COA raised in the report that payment of COVID-19 allowances of some operating units in the total amount of 814 million were not in compliance with applicable laws, rules, and regulations due to incomplete documentary requirements. Some operating units failed to establish qualifications of healthcare workers to receive those benefits and miscalculations of actual benefits. These lapses were inadvertently committed due to the objective of the government to provide immediately to frontliners these monetary benefits as a simple way of thanking them for their heroism and dedication. Currently, our hospitals are preparing their justifications and responses to the lapses raised by COA. Next slide. Around 275 million meal allowance were flagged by COA as unauthorized. In providing meal benefits, our health facilities had to be creative, especially as our healthcare workers bemoaned the provision of meals in the literal sense. Napapanisan sila ng pagkain, hindi nakakain ng tamang oras, at nasasayang lamang kung ang pagkain ang ibinibigay ng mga hospitals. The DOH sought the approval of the Office of the President to provide the meal benefits, other forms, and OP has listened to us and approved provision in cash equivalents. Hence, this COA observation must be considered as resolved. In the provision of death and sickness compensation to our healthcare workers, COA noted that around 11.6 million were paid through with incomplete supporting documents. In line with the recognition of the heroism of our frontliners, the President himself directed the department to fast-track the processing and release of these benefits. Again, these are documentary deficiencies which the operating units were directed to comply with. Next slide. There are also donations in kind with a total of 1.4 billion to which our government retained hospitals missed to submit summary report list of donations received as of December 31, 2020. To date, upon validation from these concerned hospitals, they were able to provide COA the required listings. Next slide. There were 734.5 million noted deficiencies in the management of IRM funds. The DOH is coordinating with PhilHealth to address issues regarding utilization of IRM funds. Operating units have been reminded to ensure compliance with the submission relative to the IRM liquidation. On the PhilHealth side, COA is currently conducting independent audits for implementing units concerned. Updates on this shall be provided for PhilHealth. And now for the next slide, I'd like to show to you the healthcare workers' compensation benefits. Next slide. Under Bayanihan 1 Fund, covering the period of March 24 to June 24, 2020, 75,143 public health workers were provided with special risk allowance with a total amount of 552 million. Also under the same fund, 96,524 public health workers, including contractual employees, were provided with active hazard duty pay in the total amount of 946 million, and likewise, 114 public and private health workers were provided of sickness and death benefit compensation for a total of 62.7 million. Under the Bayanihan 2, funds covering the period of September 15 to December 19, 2020, 306,314 public and private health workers were provided with special risk allowance of 3.2 billion. 384,159 public health workers were provided with active hazard duty pay of 3.3 billion and 1.3 billion of meal allowance. With the extension of Bayanihan 2 funds from December 20, 2020 to June 30, 2021, 359,501 both public and private and public health workers were again provided with special risk allowance of a total amount of 7.1 billion. For the sickness and death compensation benefits, under the Bayanihan 2 funds from September 15, 2020 to June 30, 2021, 23,081 public and private health workers were provided with this benefit in a total amount of 487 million reported as of August 2, 2021. This is the response of the Department of Health due to the audit observation report from COA. Maraming salamat and good morning to all.
Thank you po, Yusek Vega. Yusek, I will now be going through the questions po ng ating media partners previously sent to us with regard to COA-related concerns. Yusek, may we get the DOH reaction po sa inilabas na clarification ng COA regarding their recent audit report? And how does the DOH view the 2020 annual audit report? Ano po ang kahalagahan nito sa ating mga proseso?
Yeah, the COA observation or the AOMs of COA, these are actually a yearly kind of observation made to the different government agencies. This is really to improve the process and efficiency of all operating units in the government agencies. And the audit observation mentioned by COA for the Department of Health ending December 31, 2020 is not yet a final report. And we can still rectify the noted deficiencies so we can improve the efficiency and processes in our system.
Thank you, Yusek Vega. Ano po ang masasabi natin sa comment ng mga congressmen na criminal negligence and deficiencies in spending of DOH funds?
As what the COA have mentioned, the DOH is also given time to comply with the recommendations and rectify the deficiencies by submission of needed documents, which is already ongoing. So compliance really is a major issue in the 67 billion that was noted and flagged by COA. Likewise, the COA reiterated in their findings that they did not mention any funds lost to corruption.
Thank you po, Yusek. Kaya daw po bang isumite ng DOH within 60 days ang documents na hinahanap po ng Commission on Audit?
Yes, I think as we have mentioned it, compliance is ongoing and some of this has already been resolved. As presented, the deficiencies really are all compliance issues.
Thank you, Yusek Vega. Mayroon daw po ba tayong balak na mag-procure ng 4 na laptops worth 700,000? Ano po ang gagawin po dito?
Yes, the DOH has plans of procuring such laptops for the use of the knowledge management and information technology. However, to date, the procurement transaction was put on hold pending the result of the further market study and prevailing market price for these laptops.
Thank you, Yusek. Do we have updates daw po dun sa 96 million na gamot na nasa warehouse ng DOH?
The audit observation of these medicines are really more on the operating units, and the operating units have already been directed to justify. And we also noted that some of these medicines already were used since these were inventoried last December 31, 2020, and most of these medicines were used and they also had the justification already for some of their expired items. So these are really all in the operating units of the Department of Health Agency.
Thank you po, Yusek. Regarding naman po doon sa mga concerns regarding our healthcare workers and yung mga benefits po being provided to them, ano daw po yung masasabi natin sa threats of mass resignation o kaya early retirement of HCWs na hindi pa nakakatanggap ng SRAs? Yusek, if we could also explain yung proseso po ng pagpo-provide natin ng mga healthcare worker benefits and how we are able to download the funds, for example.
Yes, very unfortunate for us to be in the situation wherein there is a call for mass resignation, and at the same time there's a gap in terms of the release and even the of receiving the necessary benefit allowances for the healthcare workers. We believe that the SRA, which is really processed through the regional offices, specifically for the LGU hospitals and the private hospitals, would mean that they need to put or enlist in a master list to the regional offices those healthcare workers who directly cover COVID-19 and directly handle. And the regional office will validate this. All of these healthcare workers coming from the local government unit in the private sector. And this will actually be sent to the central office for certification of number of healthcare workers. And we do provide the funds as validated and certified by the regional offices. I know for a fact that there were some of these healthcare workers who did not benefit of this. So we've been asking actually the regional offices to coordinate with the different private hospitals and even their organizations and administration to write us and validate and certify those healthcare workers who were not given, so we can actually source out the funding for this for in the Department of Budget and Management. And we also hope that by any rule, if we push through, will include the provision of SRA, and we will have a better coordination in terms of the transfer of funds towards the regional offices and to the LGU and to the private hospitals, so that this will be better processed and coordinated so that no one is left behind.
Thank you po for that clarification, Yusek. Are there any other steps being undertaken by the Department of Health po to further improve po or mas mapabilis pa yung proseso ng paglalabas at pagbibigay natin ng mga healthcare worker benefits aside from the SRA?
All right. Yes, we do believe that the process really here and the system that we are using must have to be continuously improved. I know that this is the first time that the Department of Health has been doing this in terms of the health benefits towards the public and the private. So this time we will have a better coordination specifically with the regional offices, with the specialty hospitals of the Department of Health and the government retained hospitals, in trying to make sure that we will be able to give the necessary benefits of all these healthcare workers, so that everybody who's been handling directly COVID-19 will be given the due benefits.
Thank you very much po, Yusek. That's it for the COA and HCW related questions po sa atin. Before we, bago po tayo magpaalam po sa inyo, baka po may mga final messages po kayo sa ating mga media partners and of course sa public po na nanonood sa atin ngayon.
Okay, this COA audit report is not really final. This is really taken up by the Department of Health as part of the process of really improving our systems. This is really of making sure that we are able to comply with all the necessary rules and also give out a better and efficient delivery of our healthcare system. Now, we take cognizance of the different AOMs. We will rectify this in soonest. Most of this has been resolved. And we also believe that in doing so, we will be able to improve the Department of Health's financial capability in ensuring that all of the sectors will be provided for.
Maraming salamat po, Yusek Vega, Yusek Reset.
Yes, maraming salamat po, Yusek Bong Vega, for giving these updates and clarifications for the public's information. Thank you very much po, sir.
you, Secretary. It's nice seeing you. As
Ingat
always.
po.
As always.
Sec, sa ating media partners po, should you have clarifications with regard to the presentation of Yusek Vega, and if meron po tayong mga questions pa, ihahabol na lang po natin, and feel free to clarify po. Maraming salamat. Thank you, Yusek. Thank you po, Director Wang.
Thank you, Lindsay. All right, thank you.
Yusek, I will now be going through po yung mga questions sent to us ng ating media
You want,
partners.
yeah, you want me to answer them now? Here, right? Okay, sure.
Yusek
Yeah.
Vega, I think may mga isang pahabol question pa rin po tayo. So if you
Sige.
might want to
Yeah,
answer
of
na rin po.
course, of course.
Okay, hold on, Yusek. Yusek, regarding po ito dun sa, I think outside COA related na po ito with regards to the HCR capacity po in NCR
Okay.
and wide. What aspects are we worried about? And do you think we have the capacity po to cater more increasing cases?
Yeah, right. And this pandemic has really taught us so many lessons, and especially with the first wave and the second wave, and now this. And these were caused by different kinds of variants. The first was the Alpha, the Beta, and now the Delta variants. Now, it seems like with this Delta variants, which has been seen in almost 28 provinces and in almost 13 regional areas, there's a spike in most of the provinces and the regions that we've mentioned. And most notably is the high-risk classification of Region 1, Region 2, CAR, and definitely also of Region 3 and NCR 4A, Region 6, 7, and 10, 11. And basically, the increase is more very pertinent, especially in 6, 7, and also in the NCR. And we have been working out in terms of the treatment side, because I think this is not the only the treatment that we really have to improve on and intensify, but also the preventive aspect of this, because we know very well that if we can prevent the transmission of this Delta and lower it, we can most of these people would have a better will not have the disease or get infected. Now, on the treatment side, we have been trying to make sure that all of the hospitals are capable of handling this. So one is we have required all of these government and the private institutions to at least improve on their capacity, and they have been slowly doing this because the 2 months ago there was no, the COVID cases were low, so they really had to convert as fast as they can the non-COVID wards into COVID right now. So they are now trying to transform this, and if you can see that the isolation beds and even the ICU beds are slowly increasing, and we do hope that with this number of allocated beds in all of the provinces and also in the NCR, together with the functionalization and operation of our new modular hospital, specifically in the kidney center, and that's about 110 bed facility for moderate and severe. And then we will soon inaugurate the National Mental Institute Modular Hospital for 220 beds. And definitely there's one that we're also planning to inaugurate in Southern Mindanao. That's in SPMC. That's another 44 beds by next month. And we're also planning to ramp up the modular hospital in Region 3. So we have been constantly trying to make this necessary response, and all of these responses are really tied off with our different preparations since we started with the waves and wave 1 and 2, and then now here. We're continuously improving on it. It's still the same strategies that we are doing. What we do hope that with the necessary the vaccination around, this will be a better kind of protection. So it's really three-pronged approach: the preventive, the treatment, and of course the vaccination.
Thank you po, Yusek Vega. Yusek Reset, additional related question po doon. Do we think po ba na magte-taper off na yung increasing cases this week?
Sa ngayon, sa nakikita po natin, we are seeing that the cases are continuously increasing. So if people are expecting that we will have lower cases or reduction in cases because of what we have implemented as ECQ in certain areas of the country, hindi pa ho natin makikita yung epekto ng ECQ na pinatupad natin. After we end the ECQ period, we still need to have about 2 to 3 weeks before we can see the total effect of these lockdowns that we are doing right now. So sa ngayon po, we are still expecting that cases most probably will still increase for these coming days.
Thank you po, Yusek. For Yusek Vega, Yusek, the DOH failed to release daw 13.5 billion for healthcare worker benefits. Ano na po ang ginagawa ng DOH to ensure na makuha ito ng healthcare workers natin?
I think for the healthcare workers benefits, you mean the SRA? Is that the SRA or the compensation benefits? Or
I think the entire, they're pertaining to the entire po, Yusek.
so for the entire, I think we have already given out a slide for that. And it means that for SRA covering, let's covering Bayanihan 2, we do have 306,314 employees who are already paid coming from the 3.2 billion. And for the hazard pay for Bayanihan 2, 384,159 healthcare workers benefited from this out of the 3.3 billion. And for the sickness and benefit, 23,081 received compensation for sickness and death, 23,000 individuals, and that's covering 487 million. Now, for the remaining, we are still waiting for the Bayanihan 3, hoping that there will be a funding for this compensation in terms of SRA, hazard, and the rest.
Thank you po, Yusek Vega, for that clarification. From Caroline Bongkin po, maybe Yusek Rosette can respond to this. Kailan po yung target natin maibigay ang benefits sa mga hindi pa nakakatanggap, and gaano po katagal yung process?
I think this is more appropriate for Yusek Bong, pero pinaliwanag na po niya kanina na may procedures din po tayo na sinasagawa. Halimbawa po na ibaba na ho namin ang kompletong pera sa ating mga regional units and hospitals. This now, yung onus po nandun sa mga private hospitals and local government hospitals to submit the required documents to our regional offices and hospitals para magkaroon ng validation process. So it doesn't mean na kapag nag-compute ang isang ospital ng kanilang total at sinabmit sa aming regional office, yun na po talaga ang maibibigay. Kailangan po namin i-evaluate yan based on the existing policies para po makita natin kung compliant tayo dun sa provisions of the law on how we can provide these benefits. So yun po mga lumalabas ngayon na may utang po ang DOH ng more than 90 billion to private hospitals. Hindi yan po yung computation nila, but that has yet to be validated so that we can appropriately provide the benefits according to the rules of law. So maybe Yusek Bong can supplement my answer, Lindsay.
Tama yan, Yusek Rosette, there has to be a need for validation and of course a certification coming from the region and even the hospitals. But what is very important is that even before we can download the SRA benefits to the private hospitals, there has to be a MOA with the regional office and the hospital pertaining to this. So a MOA has to be executed by the respective private hospital and the Department of Health regional office. And for the LGU, there has to be a MOA also with the local government units. But with the local government units, they need to pass through the session of the Sanggunian. And if we can do that MOA, then it would be best. But some of the local government units have already given us this commitment for for the MOA that has to be implemented on this.
Thank you po, Yusek Vega. Yusek, ilan na daw po ang total health workers na dapat makakatanggap ng special risk allowance?
For the special risk allowance, I think we have almost 8.8 billion was downloaded to the private hospital, to the government retained hospitals, to include the specialty hospitals, and also to include the UP system, both the UPPGH and the Philippine Genome, and this would also include the private and the local government units. So for a total, we had a total of 300 ano yun eh, 300 for the SRA. We had a total of 359,501 healthcare workers.
Thank you po, Yusek Vega. From Red Mendoza, sinabi daw po ng Alliance of Health Workers that the DOH is lying due to unpaid benefits at lagi na lang daw nagpa-promise pero hindi naman naitutupad. They also allege the Secretary of Health being corrupt. Ano po ang masasabi natin dito?
Well, we have been trying to talk to them, the Alliance of Health Workers. Every time that there is a demand, we'll try to resolve this. Yeah, and we have been doing this for several months, specifically on the compensation, SRA, hazard, and we're continuously doing so. So I think that it is their right to complain, but we also make sure that we will be able to talk to them and also work out some mechanisms wherein they will be able to also be given those privileges.
Thank you very much po. I think wala na ata ako nakalimutan ng mga questions dedicated to Yusek Vega. Again, maraming salamat po, Yusek, for accommodating us po and yung mga tanong po ng ating media partners.
Thank you, Yusek Bong. Maraming salamat.
Thank you, Yusek Rosette. Thank
Yes,
you.
sir.
Bye-bye.
Yusek Vega.
Okay.
Yusek Rosette, I think we can go through the other questions raised po for you. From Marites Eliano, ma'am, Dr. Edsel Salvania said that some of the Delta breaks in Mindanao were returning overseas Filipinos who arrived via Mactan Airport in Cebu. Ano pa ang masasabi ng DOH dito?
Well, unang-una, syempre, nung sinulat ito ni Dr. Edsel, that was a personal or an independent comment, no, coming from somebody who is also an expert on this matter. Meron po kaming ginagawang mga analysis as we have explained to all of you yung phylogenetic analysis na ginagawa natin where we can be able to identify the sources of infection. So sa ngayon, patuloy pa ho yung pag-aaral natin. Iniisa-isa po natin yung mga common sources natin of these variants of concern that has come in the country. So we cannot confirm as of yet right now. We are continuing our studies on this and we will be informing the public as soon as we complete the study.
Thank you po, Yusek. From Christian Day Parine, may new guidance or protocol po ba ang DOH for the use of air purifiers and does this help prevent infection? Kristen Cebu said that the provincial government in Cebu's move requiring this for PUV drivers and conductors is a mere band-aid.
Nakapagpalabas na po kami. I think that was as early as the pandemic started that the DOH do not recommend these air purifiers. Ito po mga necklace na purifiers. Sinabi na ho natin dati yan na wala ho yung ebidensya. Bagamat hindi po ito nakakakos ng harm sa isang tao, pero hindi rin po siya nakakapagbigay ng proteksyon laban sa COVID-19. So what it will do, it will give that false security to our kababayans na baka magkaroon ng complacency because of this and baka lalo pa tayo magkaroon ng infeksyon. Nakapagpalabas din po ang Philippine COVID-19 Clinical Practice Guidelines, yung ating living CPG, ng kanilang rekomendasyon tungkol dito. And it states that we recommend against the use of ionizing air purifier to reduce COVID-19 transmission in the community. It has low quality, yung mga ebidensyang meron, and the recommendations are very strong. At ito po yung nasa official policies namin that we adopt whatever recommendations the Living CPG Group will provide. So sa ngayon po, talagang hindi po natin nire-recommenda yung mga necklace air purifiers. At sinasabi na po ng ebidensya at ng mga eksperto, it's not going to provide you with that protection, and it might lead to this complacency or yung false security sa ating mga kababayan. So sana po, hindi na lang po natin ito gamitin.
Thank you very much, Yusek. From Carolyn Bungkin, what do we know so far about the first Lambda case, and possible po ba na super spreader ang variant na ito? In addition po, since local case po ito, do you think this was due to a lapse in the quarantine protocol?
Well, alam po nating lahat na itong mga different variants of concern or variant of interest. Let me just clarify, the Lambda variant is still a variant of interest. It is still not classified as a variant of concern by the WHO. Alam po natin lahat na ang mga pinanggagalingan talaga ng mga infeksyon, sources, most common, of course, would be outside of the country and going in our country. Although meron din naman pong mga mutations na nangyari na dito sa ating bansa, katulad ng P.3 na dito po unang naitala at nai-report para po dito sa ating mga variants of interest and concern. Ito pong ating Lambda variant na kaso ay atin pong na-detect. This is a 35-year-old female. Wala po siyang simptomas. Siya po ay classified na as recovered. But of course, we are still validating and we are going to do repeat RT-PCR. So siya po ay currently nandun po dun sa lugar nila, and we are trying to coordinate. Apparently, based on record, she is also pregnant. So yan lang po ang aming nakalap pang impormasyon sa ngayon. We are coordinating already with their city health officer para po malaman pa natin yung mga ibang ginawang mga aksyon. Although kailangan natin maintindihan na nung na-diagnose na po itong pasyente na ito nung July 22 through RT-PCR, the contact tracing and the other actions were already done. So hindi po tayo amiss sa mga ganyang aksyon kapag tayo ay nakaka-detect ng mga kasong positibo. Pag sila ay nag-positive sa isang variant of concern, and then we do community-level interventions.
Thank you po, Yusek. From Jessel Ricafort, posible daw po na hindi sagutin ng DOH ang gasto sa mga posibleng adverse effects ng mga nagpapaturok na ng booster shot. Can you please clarify po kung ang ganitong incident ay hindi pasok sa indemnity fund?
Well, sa indemnity fund, ito po ay officially naman nasa polisiya na. Nakalagay po doon, serious adverse events ang i-cover, pero kailangan has been evaluated by our National Adverse Events Following Immunization Committee para maging eligible for this PhilHealth Indemnity Fund. So ang claimable cases po natin, yung mga serious cases lang po as identified by PhilHealth based on the specific criterion. First, hospitalization due to anaphylaxis and the other related serious conditions. Pangalawa, magkaroon ng permanent disability yung tao based on causality assessment that the vaccine has caused that. And the third would be death. So yung claim submissions po, dito po pinag-aaralan niya ng NAFIC at saka po natin madidesisyonan. So ngayon, kung sakaling nagpa-booster dose kayo, wala po kayo sa protocol, at kung magkaroon kayo ng mga reaction, of course, government will still take care of you. Kahit na nag-violate kayo ng mga protocols namin, imo-monitor pa rin po namin kayo. But as to the indemnification, kailangan pumasok sa criteria, pag-aaralan, pag nakita na meron pong direct cause ang vaccine, and that's the time that indemnification will be provided.
Thank you po, Yusek Reset. Additional question from Jessel po. Secretary Galvez said that those who received Sputnik 5 as their first dose can have AstraZeneca for their second dose kung magkakaroon pa ng delay ng supply. But Dr. Gloriani said na posible pang mabago ang rekomendasyon na ito. Do we have any updates here?
Yes, no? So currently pinag-aaralan natin maigi itong sitwasyon na ito because we are seeing the delay of the delivery of the second dose for the Sputnik V vaccine. So kailangan po maintindihan ng ating mga kababayan yung component 1 at saka component 2 ng Sputnik V vaccine ay magkaiba. Although they have the same platforms, but they have different components. Kaya kailangan natin talaga antayin yung second dose ng Sputnik V. Ngayon pong nadidelay po itong mga second dose na ito, at syempre ang ating mga eksperto together with our government officials are discussing what would be our options. So tinitignan po natin yung mga different vaccines available in the country, what would be most appropriate to give to partner with Sputnik V. And as of this time, we do not have complete evidence yet. Whether it be the AstraZeneca o yung tinatanong nyo na Sputnik Light, wala pa po tayong kompletong ebidensya. Kaya ang ating all experts po nagrekomenda, kami po ay magkakaroon ng pag-uusap din. They are trying to evaluate these different platforms. Pero sa ngayon, they cannot recommend yet kung anong klaseng bakuna ang pwedeng ibigay as second dose for this Sputnik V doses na naibigay as initial. Ang ginagawa po ngayon ng gobyerno ay sumulat na po tayo sa manufacturers. We demanded already that during this certain time period that these doses should be delivered to the country. And if they cannot deliver, they have to tell us already and advise us so that we can properly identify options for our citizens who were given this first dose of Sputnik V.
Thank you po, Yusek. Any updates daw po dun sa guidelines ng A2+1 vaccination na tinutukoy po ni Yusek Kabutahe?
Yes, no? So ito po ay maglalabas ng official na advisory ang ating vaccine cluster. No guidelines naman na po na needed because A2 really, hindi naman natin binago ang prioritization framework natin. A2 pa lang yan. It's an operational strategy para mas mahikayat po natin ang ating mga nakakatanda na mabakuna na kung isasama po nila yung caregiver nila o di kaya isang anak nila, mas mapipilitan or mas ma-encourage natin sila magpabakuna. Kasi ayon po sa mga pag-aaral namin, ang isa po sa hesitancy ng ating mga nakakatanda sa kanilang pagbabakuna is yung kanilang parang safety. Pero kapag nakikita daw nila na yung mga kamag-anak na nila ay nabakunahan na, o di kaya yung mga kamag-anak nila ay hindi nakaranas ng kahit na anong reaksyon, na-encourage na sila. So ngayon po, ito pong strategy na ito is A2+1 na ang ating mga nakakatanda maari nang magdala ng isa nilang kasambahay o di kaya isa po nilang anak o maybe pamangkin, kung sino man ho, basta part of their household members para po mabakunahan, para po sila ay mas ma-encourage at tumaas ang ating pagbabakuna sa ating nakakatanda. Ito pong guidelines na ito are operational guidelines that will be issued by the vaccine cluster.
Thank you po, Yusek. From Sheila Crisostomo, if a person is unknowingly infected with COVID-19 and he gets vaccinated, what is the effect on the effectiveness of the vaccine? Mababaliwala po ba ang bakuna at hindi kailangan magpabakuna ulit?
No, Sheila, kung sakasakali, meron kasi mga tao, wala silang simptomas. So hindi po nila alam, nagpunta sila, nabakunahan sila. We just wait it out. We observe, but we still continue on the vaccination. Wala naman po magiging epekto yan doon sa efficacy ng bakuna sa inyong katawan.
Thank you po, Yusek. Yusek, are we okay to accommodate more questions po?
Yes, go ahead.
From Lay Alvis po, ma'am, masasabi ba na may community transmission na ng Delta variant? And second, ito na ba ang nagiging dominant variant sa Pilipinas sa bilis ng pagkalat nito?
Well, sa ngayon, Lay, because we are just doing percussive sampling. Ibig sabihin, hindi natin na gagawa ng whole genome sequencing ang lahat na nagpo-positibo sa ating bansa. Wala naman pong ibang bansa na gumagawa niyan actually. Pero kapag sa tingin natin, yung kung we assume that there is already transmission in the community or community transmission, that's an assumption. Because as I've said, we can still provide evidence for such. Pero ang mga action po na ginagawa natin ngayon is towards that direction already that there is community transmission. You have to remember that these levels of transmission is officially declared, because of certain evidence that are found in a country. Bago po maitala iyan at masabi ng WHO na ito na yung level of transmission sa bansa. Although let me reiterate na ang assumption na po ng ating gobyerno ngayon is we already have that community transmission and we are acting as if there is community transmission. As to the percentage of Delta variant cases na atin pong nadidetect, pag tinignan po natin, mas marami pa rin po yung ibang variants of concern if we compare it to the overall cumulative number of samples tested. Alpha and beta variant still comprises most of these sampled specimens that where whole genome sequencing was done. Pero pag tinignan natin kasi yung sa Delta variant, kino-compare kasi namin per run. So for example, this latest run, we had 338 samples. And pag tinignan natin yung mga na-detect natin ngayon na Delta variant, it's almost half. So more than almost 50% po ang Delta variant among these 338 samples in the latest run. So makikita ho natin na talagang mukhang yung proportion ng Delta variants dito sa ating bansa based on this initial and very rough analysis ay mukhang tumataas po talaga.
Thank you very much for Yusek clarification po. Yung Lambda case po ba ay isang local case, and kung vaccinated daw po ba yung Lambda case natin? And if we do know yung particular location po of this Lambda case?
Actually ngayon, Lay, hanggang ngayon, binavalidate natin ang information. So as we have released our initial information yesterday, we are closely coordinating with the specific locality where this individual is. Ang aming most probable, it's a local case kasi nakita po natin siya among the persons in the community at kasama po siya dun sa na-sequence kasi apparently may cluster, kaya siya kasama dun sa na-sequence. Pero sa ngayon, ang aming pinaka-probable na classification sa kanya, mukhang local case talaga ito. Ngayon, itong local case na ito, nasa Region 6 siya at amin pong binavalidate pa further lahat ng impormasyon na meron sa ngayon, kinukuha rin po natin yung status ng kanyang pagbabakuna.
Thank you po, Yusek. From Caroline, tama daw po ba na Delta is present in all regions already?
Sa ngayon, based on our specimen sampled, all regions except Caraga. So lahat po ng regions, based on the recent run, meron na. Pero ang Caraga po, wala pa po kaming nadidetect. But it doesn't mean that they do not have the variant. Katulad nga ng sabi natin, yung sampling po kasi natin ang ginagamit natin and it doesn't really cover that much of the population for us to determine kung nasaan na siya sa mga regions. So ngayon, we still assume na meron na rin and that is ito na yung mga actions natin na ginagawa.
Thank you po, Yusek. From Ian Cruz, kamusta po ang mga isolation facilities natin, especially sa NCR? Paano po kapag napuno na ang mga facility ng LGU? Saan po pwedeng dalhin ang mga COVID-19 positive?
Well, meron po tayong tinatawag na referral network. Kaya nga po natin pinapagana ito. Meron tayong dapat navigation from our local governments. Sila yung unang point of contact dapat ng mga pasyente. Nagpalabas po kami kagabi ng mga hotlines ng iba't ibang local governments natin para dito po unang tatawag ang ating mga kababayan. Our local governments will navigate these patients. Kung kailangan po ng isolation or quarantine facility, yun sa kanilang lugar, doon po natin nilalagak. Pagkatapos po nun, meron pa rin naman tayong mga mega temporary treatment and monitoring facilities. Ito po yung malalaki natin na mga facilities na minamanage po ito ng national government and it is linked with our One Hospital Command Center. So ito pong mga kababayan natin na nangangailangan ng isolation and quarantine can also be admitted in these facilities. Sa ngayon po, we are still looking for other facilities where we can expand. Actually, nag-renew na po ng mga kontrata for the hotels na ginagamit natin dati accredited as quarantine facilities ang ating mga concerned government agencies para madagdagan pa ho ito pong ating mga ginagamit na isolation and quarantine facilities. So sa ngayon po ang ating TTMF utilization overall would be remains at 22%. But when you look at the different regional utilization, specifically NCR, meron ho tayong 44% utilization among their TTMFs sa local governments nila. Ang atin naman pong mga mega temporary treatment and monitoring facilities, these are the big ones managed by the national government. Ang atin pong utilization for this week ranges from 60 to 76%. So ito po ngayon ay medyo pinabantayan natin dahil nasa 76% na po yung ibang mga facilities na malalaki para makita po natin kung saan pa ho tayo pwede mag-refer ng ating mga pasyente.
Thank you po, Yusek Rosette. Yusek, if you have the data daw po, parang ano yung mga katangian ng mga Lambda variant natin, Yusek?
Well, the Lambda variant, according to the literatures, no, ang Lambda variant, sinasabi nila highly transmissible din siya. Merong ibang literature, sinasabi nila that it can be the same as the Delta variant, no? Pero tinignan namin kahapon, no, nung nagmi-meeting kami with our experts, yung kanyang spread across the 26 countries where it is already identified. Nakita natin dito sa 26 countries and mostly in Latin America na hindi ganon ang kanyang kabilis ang spread niya as compared with the Delta. Mas predominant pa rin ang mga Delta variants dito sa 26 countries na meron Lambda variant na identified. Second, sinasabi rin dito sa literatures na nakaka-apekto rin sa immunity ang Lambda variant. No? So it means that ito pong Lambda variant can affect vaccines, apparently, sinasabi. No? Pero ang lagi natin pinapaalala, lahat naman po ng most of the variants of concern that we have right now, like Beta and Delta, affects the efficacy of vaccines. Pero ang laging sinasabi ng ating eksperto, aside from the level of antibodies na tinitignan natin for our vaccinated individuals, meron pa ho tayo nung tinatawag na cell-mediated immunity. These are the T cells na hindi po naapektuhan ng mga variants na ito. At ito po ay natitirang panlaban natin na dulot pa rin at bigay sa atin ng bakuna. So magpapabakuna pa rin po tayo dahil ito po ay effective pa rin sa mga variants na meron sa ngayon.
Thank you po, Yusek. Yusek, may ilan daw pong mga comments and reactions na hindi po daw accessible at walang sumasagot doon sa hotlines ng One Hospital Command Center. Do we have enough staff to man and receive calls po?
We have improved our services for the One Hospital Command. No? Nakapagdagdag na po dyan ng additional na mga personnel to answer the hotlines. Nakapagdagdag din po ng serbisyo where telemedicine services are being provided already regularly 8 to 5 o'clock in the afternoon. Meron na rin po tayong institutionalized system of referrals and transport of patients. So sa ngayon po, pagka tumatawag tayo, minsan may traffic talaga. Lalong-lalo na po ngayon na napupunta lahat sa One Hospital Command natin ang mga tawag. Dahil ang mga tao po, hindi na utilize masyado ang ating local government hotlines. Kaya po pinalabas namin kagabi, ito pong listahan ng local government hotlines para ipaalala po sa ating mga kababayan. Sa local government hotlines po tayo tumawag para po tayo ay mabigyan agad ng guidance na kailangan natin, manavigate kayo. Kung sakasakaling kakailanganin nyo ang ospital o di kaya ay mas mataas na antas ng isolation and quarantine facility, tsaka po ililink ng local government natin ito pong tawag na to sa ating One Hospital Command. So if we can have that kind of a system, hindi po tayo magkaka-traffic at mabibigyan po natin ng serbisyo ang mas nakakarami kaysa hindi po natin makontak dahil punong-puno na po ng tawag at nagkaka-traffic na po sa mga calls dito sa One Hospital Command natin.
Thank you po, Yusek. Yusek, hindi daw po sapat yung mga restrictions dahil marami pa ring lumalabas o talagang mas mahirap mapigilan ang pagkalat ng Delta variant. Kaya hindi pa rin po bumababa ang mga kaso. If we could explain po, Yusek, yung mga factors affecting po yung mga case increases natin that we are seeing recently.
Well, I'd just like to again remind everybody that we are not going to see yet the effect of these restrictions that we are implementing for this time being. As I've said, after the ECQ that we have implemented, we wait for about 2 to 3 weeks before we can see the effects or the initial effects of these restrictions. Kung matatandaan nyo po, nung tumaas ang ating mga kaso noong March and April, nakita ho natin na unti-unti pa lang bumaba ang mga kaso towards the end and the early part of May. No? Towards the end of April and mga second yata week of May nag-umpisang bumaba. At nakita natin na talagang nagluwag ang ating mga ospital mga towards the end of May already. So ganun po talaga because there is this incubation period of the virus. As to the factors on why cases keeps on increasing, marami tayong factors na lagi naman natin pinauulit-ulit. Pero ngayon, nakita natin, base sa ating pag-aaral, analysis of what's happening, 39% pa rin po ang mobility dito po sa NCR. Yung 39% comparing, no, this is 39% more dun po sa sinagawa natin na paghihigpit natin during the March and April and even the March 2020 na lockdown natin. So ibig sabihin, ang mga tao ngayon lumalabas pa rin po talaga, nagkakaroon ng interaction, and therefore the disease transmission hindi po natin natatapos. If you will remember, over the weekend, nagpalabas po ang ating DILG through their PNP that there were a lot of violations on minimum public health standards, no? So both in Region 4A and in NCR, where there are a lot of cases dito sa atin. So kung yung safety protocols po natin, hindi natin maipapatupad and people are not complying, therefore we expect that cases would continue to increase. And of course, the major factor po natin sa ngayon talaga, the driver is the Delta variant. So with all of these factors, na aggravate po lahat ito, no, na kasi mas transmissible yung meron tayong variant ngayon. So there is mo tayong mga hindi compliant sa safety protocols, at pagkatapos nun, ang naipapasa-pasa ng bawat isang tao ay isang delikadong variant katulad ng Delta variant, which can infect about 8 persons in just one interaction. So ganito po yung nangyayari, kaya patuloy na tumataas ang ating mga kaso.
Thank you po, Yusek. Yusek, if we could clarify lang daw po, I think yesterday sa ating press release or sa ating report, we mentioned that there are already 3 cases of Delta sa Caraga. Baka we can clarify daw this, ma'am.
Yes, no? So kailangan po maintindihan, and I'm sorry I missed that out, no? So paliwanag ko lang po, lagi po namin sinasabi, we do validation, revalidation, binabalikan po natin. So at the outset, nung nakuha namin yung results ng sequencing, amin pong hinahanap na yung mga kaso na yan dito sa system natin sa COVID kaya. Pag nakita na ho natin at na-match na natin yung may sequence at saka yung may kaso na pangalan, itatawag na ho namin yan sa local government. So yung initial po na nakuha natin is from Caraga, but upon further verification and coordination with the specific areas, we were able to validate na hindi po pala taga Caraga, but these were returning overseas Filipinos. Ang kanilang address were Caraga, pero sila ay returning overseas Filipinos. So ibig sabihin, hindi natin siya i-classify as a local case in Caraga, siya ay returning overseas at hindi pa sila nakakabalik mismo doon sa Caraga. Sila po ay na-isolate pa lang dito sa national facility natin. So yun po, just like to clarify that it's part of the process. That's why we are trying to correct it right now.
Thank you very much po, Yusek. Yusek, that's all the questions that we can accommodate for today. Before we end our media forum, do you have any other messages po para sa ating public and of course to our media partners?
Yes, thank you, Lindsay. No? So pagtatapos ng ating media forum, nais po namin muli magpasalamat sa ating mga media partners sa patuloy po na pakikiisa sa paghahatid ng mga mahahalaga at saka wastong impormasyon ukol sa COVID-19 at iba pang issues, no, na kailangang malaman ng ating mga kababayan. Sa patuloy po na pagtaas ng mga kaso sa ating bansa, mariin po naming inuulit, paalala po upang mapigilan ang pagkalat ng COVID-19. Patuloy po ang aming panawagan sa ating mga kababayan. Isuot po natin ng tama ang ating face mask at face shield. Mag-physical distancing po tayo. Huwag po tayong pumunta sa mga masyadong matataong lugar. Always ensure that there is adequate ventilation doon po sa inyong, kahit sa inyong bahay. Atin din pong nagbibigay ng paalala rin sa ating local government units. Pag-igtingin po natin ang paghahanap nitong mga kasong may mga simptomas na o di kaya ay na-expose or di kaya ay close contact, i-quarantine na po agad para po maputol natin ang ating transmission sa ating community. Pinapaalalahanan ko rin po ang ating mga kababayan na kapag po kayo ay nakakaranas na ng simptomas ng COVID-19, kung sakasakali po na makati ang lalamunan, sinisipon, bahin ng bahin, nilalagnat, may ubo, masakit ang katawan, wag na ho tayo mag-aagam-agam o mag-wait, no, to don't be hesitant na mag-quarantine na agad at tawagan ng local government units natin para po malaman na po kung ano ang dapat nyong gawin. Pero ang pinaka-importante, mag-isolate or mag-quarantine na para maputol po ang transmission at hindi nyo maihawa ang inyong mga kapamilya sa inyong bahay. Piliin po nating magpabakuna, tayong lahat, lalong-lalo na sa mga panahong ngayon. Kung kayo po ay eligible na, please get yourselves vaccinated. And lagi nyo pong tatandaan ng isang bakuna ay hindi po nakakapagbigay ng adequate protection against the COVID-19. You need your 2 doses. You need to be fully vaccinated para po tayo ay magkaroon ng protection. At para naman po dun sa ating mga kababayan na nakakarinig at nabibigyan ng impormasyon na ang bakuna ay hindi importante at hindi makakalaban sa COVID-19, kami po sa Kagawaran ng Kalusugan and the rest of the national government agencies, humihingi po kami sa inyo ng tulong para po atin pong maipakalap sa ating mga kapitbahay, sa ating mga mahal sa buhay. Ang bakuna po ay matagal na pong technology dito po sa buong mundo. Ito po ay nakapagpigil na ng mga kutakot-takot na mga pandemya at outbreak sa lahat ng bansa, including the Philippines. Ito po ay nakapagsalba na ng ubod ng dami ng buhay ng mga bata at ng matatanda. So para ngayon po dito sa ating nangyayari sa ating sitwasyon at nakikita po natin ang mga datos natin sa ating mga ospital at sa ating komunidad na ang mga walang bakuna po ang mas nagkakasakit, ang mga walang bakuna ang mas nauospital. Kaya hinihikayat po namin ng lahat na sana po makinig lamang po tayo dun sa mga verifiable sources, makinig po tayo sa ating gobyerno. Amin pong sisiguraduhin na ang mga bakunang ito ay ligtas at magiging epektibo po para sa lahat. But this is the only way, plus the minimum public health standards, para po tayo lahat ay maproteksyonan against this COVID-19 virus. Yun lamang po, maraming salamat po sa inyong lahat and thank you, Lindsay.
Thank you very much po, Sec, sa ating mga media partners. See you again tomorrow. We will be providing yung usual COVID-19 updates natin. Maraming salamat and happy Monday.